Um, Welcome. My name is Eve Wasserman, and along with my co-chair, Alice Greenberg-Sheedy, and our entire social justice group of Oheb Shalom congregation, we welcome you, our dear friends and family, our synagogue family, and colleagues, community members, professionals, all who have joined us tonight to talk about the interaction between the police and those that suffer from mental health issues. We thank our Men's Club and Sisterhood for partnering with us on this program, and a special thanks to our dear friends Orly and Richard Prince, who generously underwrote this program for us tonight. We thank you. Our social justice chair people, Abe Eunice and Terry Harrison, along with our entire group, offered to dedicate our program to my sweet nephew, Alex, who died in a tragic accident only 4 months ago at 28 years old. Alex suffered from depression and was committed to destigmatizing mental illness. By dedicating our program to Alex tonight, we help to sustain his legacy. Less than a year ago, our social justice group was founded to educate ourselves and others when it became apparent that we can no longer ignore racial issues in our very own community. Tonight, we plan to explore the issue of police interaction with individuals with mental health issues. All of us can easily conjure up heart-wrenching images and articles of events as recently as today that speak to the devastating reality of these interactions. Our speakers tonight will discuss recognizing a mental health crisis and steps necessary to de-escalate a police encounter. Our panel will include Dr. Barbara Prempeh, a clinical psychologist and the co-developer and co-facilitator of a trauma-focused curriculum for police officers and community members in Newark. Captain Richard McDonald of the West Orange Police Department, who oversees all in-service training, the lead instructor for de-escalation techniques. And the New Jersey mental health players, who use real-life scenarios depicting mental health and substance abuse to educate and bring awareness. Each of our panelists will speak for 15 minutes, and then the mental health players will begin their scenarios.
Welcome, everyone. Please keep in mind that we've all been muted. Questions are certainly welcome and encouraged, and please use the chat during the question and answer portions of the program. And I ask you to direct all questions to me, Alice Greenberg-Sheedy, and I'll make sure that your question is asked. I'm delighted now to turn the program over to Dr. Barbara Prempeh.
Hi, thank you for having me. I just want to make sure the PowerPoint is showing right now.
Yes.
Great. So I'm just going to briefly talk about mental health and policing and really diving into the symptoms that can be of concern over certain disorders that police often have interactions with. So also providing rates of police encounters and fatalities with individuals with mental illness, and of course touch on a little bit as it relates to substance abuse and police encounters with the opioid epidemic. So first, just looking at some of the stats, people with untreated mental illness are about 16 times more likely to be killed during a police encounter than other civilians approached or stopped by law enforcement. And this is according to a study conducted by the Treatment Advocacy Center. Additionally, individuals with untreated serious mental illness are 1 in 4 fatal law enforcement encounters, and as many as half of fatal police shootings. So because of this prevalence, reducing the encounters between on-duty law enforcement and individuals with the most severe psychiatric disorders are very important, and it's an immediate issue that needs to be addressed. Additionally, due to their higher rates of encounters with police, they account for 1 in 5 individuals that are in jail and prison, and 1 in 10 law enforcement responses. So looking at schizophrenia for a second, and what are some symptoms that maybe they present in individuals with schizophrenia that can warrant concern for likelihood for interaction with police? So schizophrenia in of itself, right, has a range of problems with thinking, cognition, behavior, and emotions. So some signs and symptoms may vary, but usually individuals with schizophrenia experience delusions, hallucinations, or disorganized speech, and also extremely disorganized or abnormal motor behaviors. So, first, talking about delusions, these are false beliefs that the individual has that are not based in reality. So, for example, they may feel as though they're being harmed or harassed, that certain gestures or comments that others are making are directed towards them, or that some type of major catastrophe is about to happen. So these delusions occur in most people with schizophrenia. And think about that when it comes to the interaction with policing. It may be difficult, it is difficult to kind of speak to the individual and have them believe that these things are not happening. They believe these delusions to be true. Additionally, they also have may encounter hallucinations, and these usually involve seeing or hearing things that don't exist. But for that, the individual with schizophrenia, they have full force belief that this is a normal experience that they're having. So you can't say to them that their hallucination, that there's someone standing right across from them, is not true, because for them, that's their reality. Or the voice that they're hearing in their head is not true, because again, for them, that's their reality. So this is where aggression may show in when someone is telling them that no, there's no one actually there that you are seeing, or you're not hearing the voice that you think that you're hearing. And that's where conflict towards others, even loved ones, may come about and may warrant others coming in to provide support and help for the individual. So hallucinations can be an issue, and hallucinations impact any of the senses that we have, but the most common is hearing voices, and those are auditory hallucinations. So the disorganized thinking that can interfere with their speech. So this is when someone is trying to communicate with them and their communication is very impaired. They're unable to answer questions, partially or completely answer in a way that's completely unrelated. So imagine them having an encounter with police and the police officer is asking questions and they're not able to provide clear responses. This may escalate a situation, right? They're not able to put together meaningful words that can be understood by others. And this is typically what we would call a word salad. Uh, Also having disorganized or abnormal motor behaviors. And this is where they may act in ways that may appear to be very unpredictable in their agitation towards others, right? So they'll be resistant to any kind of instructions that's provided to them. They may display any inappropriate or bizarre postures, and definitely lack response to others' commands um, of them. So all of these symptoms can definitely vary in the way that they're displayed and the severity of them over time, which can increase and worsen during the interaction. So we have to keep this in mind for individuals who have schizophrenia. And it's very important that when, let's say, you are a family member that has um, a family member with schizophrenia that's going through a psychotic episode and are displaying these symptoms, it's important to be very clear in your communication to the police what symptoms they're actively displaying right now, so that can provide information to them to be able to know what to expect when they're coming out to the home to try to help de-escalate. You know, it would be helpful if many of the individuals, when there are calls that family members identified, you know, the family member having a mental illness, that officers are aware and educated, or rather a social worker comes out. But unfortunately, that's not the situation that we're in. So it's important to kind of provide as much information when calling for help from law enforcement, so they know what they're walking into. looking at Alzheimer's and dementia, so aggression occurs in about half of the individuals diagnosed with dementia and is associated with more cognitive decline and increased risk of abuse and caregiver burden. So as you can see, there's three stages when we talk about Alzheimer's. And so the earliest stage has more lower or less aggression involved, right? And this is when the person may function independently and things of that nature. And again, still there's much less likelihood of aggression towards others, right? They may have some slight forgetfulness and confusion and some moodiness. But again, aggression is much lower. Looking at the middle stage, this is where the individual feels moody or withdrawn, right? And aggression may increase a little bit more. And of course, the middle stage is the longest stage of Alzheimer's, can last for many years. And dementia symptoms are more pronounced during these stages. And so the person will have more difficulty in their interaction with others. You may even notice the person using confusing words or getting frustrated and angry more often, or acting in ways that are unexpected, right? And refusing to comply with commands. And this again can contribute to their interactions with others, especially in police. And of course, the forgetfulness that comes with it can have them wandering off without knowing where they're at, who they are, and things of that nature. And the last stage, the late stage, is the most severe stage, where the most severe symptoms occur. And this is where the individual has lost awareness of recent experiences as well as their surroundings, right? And with this loss of awareness, they may get frustrated or agitated if someone is coming up to them, confronting them, and things of that nature. So these are all things to keep in mind and to also inform others of when they're interacting with individuals with Alzheimer's. Another disorder to take a look at is in regards to autism, right? Autism spectrum disorder. And autism spectrum disorder ranges where the individual there's 3 levels that's notated in the DSM, from the individual requiring support, right, and still able to do a lot of things on their own, to level 2 requiring substantial support, and level 3 requiring very substantial support. So first, in regards to inflexibility, right, on all 3 levels, the individuals with autism typically inflexible in their behavior, which causes their interference with others, right? So sometimes they can display a lot of rigidity in what they're doing and how they're doing it. So if, for instance, you say, all right, it's time to change task or time to stop what we're doing right now, they may get very frustrated and aggravated because they want to continue in what they're doing right then and there in that moment. So keeping in mind that inflexibility can lead to frustration, irritability, and aggression. Difficulty coping with change, right? And this can happen with refusal to leave a place. There has been incidents where there was an incident of an adolescent with autism refusing to leave a play center with his mother. And so she decided to call, it was, I believe, the security for the shopping center for help. And, he continuously became aggravated as more of the officers came. And unfortunately, it resulted in a death because they were trying to restrain him. And it just was in a way that was not effective and ended up in his death. So that inflexibility, that difficulty to transition in what they're doing, if others are not truly aware of this being a symptom of autism and that really going against what they would want triggers them even more, it can further escalate things. And also repetitive behaviors that they engage in, right? Some of their behaviors are similar to individuals with OCD. And with those repetitive behaviors, again, really rigid in what they're doing. And so it's important to let if you're making a call to get support from police, it's important to let them know what behaviors the individual with autism is displaying at that time. And also there's some sensitivity that individuals with autism have, right? Whether it's to certain sounds or even to lights or even textures, even colors, they're very sensitive to. All those special things, please let others know, because if police are coming and their sirens are going off and the individual with autism is sensitive to that, that can escalate them and make them agitated or irritable already, in addition to the lights that may come with officers arriving as well. And lastly, just to touch on the opioid epidemic. So this is the statistics, right? In regard from the National Institute of Drug Abuse. Every day we have about 128 people in the United States dying from an overdose of opioids, right? And you see those numbers are really alarming. And there has been instances where now that there's so many programming and support, that has been some reduction that has been seen. However, it's still an epidemic that we're going through. And, aggression in general, right? Substance use that leads to aggressive behavior in general ranges from all drugs that are used, from alcohol to cocaine to amphetamines, and also opioids. And these are all associated with increased aggression and violent behavior. So when we're talking about opioids, most of them are the prescription drugs that are given to others. And this chronic opioid use has been associated with aggressive behavior. So again, it's important to be aware of the substances that individuals are using, right? If you do know that, oh, the person has used a substance and they're starting to engage in certain behaviors, or they're starting to become physically agitated and irritable, it's important to communicate that, or to look out for that when you know that someone has utilized a substance. Because keeping in mind that things can get escalated, especially when they see police coming. That's my portion.
Thank you so much, Dr. Prempeh. And now we're going to have Captain McDonald speak to us.
Hello, can you hear me okay?
Yes.
All right, excellent. I just want to start off by really thanking the committee, not only for putting this together, but inviting me to speak. And for law enforcement, we always understand that law enforcement's dropped the ball in many areas. And one of the areas that I always say we need to be better at is communicating. Communicating with the public about what we do, how we do it, and most importantly, why we do it as well. So this is an incredible opportunity just to speak with people with great open hearts to be able to put all this together and really just want to further the conversation along and get everybody on the similar page to making our world a better place. So I thank you for that. I am representative of the West Orange Police Department. So I'm going to tell you what we've been doing over the past few years, and especially the last few months. I don't speak for all agencies. There's 350 different police agencies in New Jersey. So I can speak for myself and, my counterparts in surrounding towns who I've spoken with. But, like any business, every town's a little bit different. Every department's a little bit different. So in terms of West Orange, I wanted to talk to you about our mental health responses, what the numbers look like, tell you about the training we've been doing over the years, and really get into this new program that we just started about 5 months ago, which I think is an amazing idea. Just to put things in perspective about West Orange, we did a study of our mental health responses for the first half of 2020. So it's just the first 6 months. In those 6 months, we had 197 calls for mental health crisis. So we're averaging about 8 a week at that point, which, for a town the size of West Orange, I'm sure South Orange and other suburban towns around us are pretty similar in their numbers. So out of 197 calls that we went in the first half of 2020, in terms of how these calls finish up, 125 of the calls concluded with the subject being transported to a mental health facility. Out of those 125, 89 of the transports were voluntary. 36 were involuntary. Now, involuntary means that us as officers found them to be a danger to themselves or to others, and we had to assist with them getting transported for help. Or it could have been a doctor or a mental health worker is found them to be a danger, so that we had to assist in an involuntary transport. Out of all those calls in those 6 months, only one resulted in an arrest. And we had 72 other calls for service, which were resolved with no transport or arrest. So that's just to give you a generalization of those calls. Because the ones we see in the news are obviously the calls that didn't go well, that didn't get resolved peacefully and safely. But out of those 197 calls in West Orange, 38 calls involved a report of an individual having a weapon, being violent, or making aggressive, threatening actions. So you're looking at about 20%, or 1 in 5 calls that we go to have the propensity to be violent before we even get on scene. We also had, out of the 197, 39 calls involved the threat of suicide. And we know once a person's considering suicide or making suicidal actions, that again ups the stakes to our reaction as well. So basically 39% of the calls we went on, almost 40%, subjects were either violent, overly aggressive, making threats, having a weapon, or threatening suicide. And out of all those calls, 197, we used verbal de-escalation skills for 72 out of them. So did I say that right? Yes. So out of those 77 high-risk calls, 72, we were able to use verbal de-escalation. The other 5 times we had to use some kind of a force option. Now, the force options that we were able to use were the minimum amount of force. 2 of those incidents just involved, we call it, we tackled them. They were running into traffic, and we did the old wrap them around, escort them to the ground for their safety. Obviously, it was to protect them. On 3 of the other calls, it was just we had to use compliance holds to be able to get handcuffs on them to escort them to the mental health facility. Now, out of 77 calls that could have gone bad, the fact that twice we had 5 times we had to put our hands on people, twice we had to take them to the ground. It's really amazing, you know, that we're lucky that all these situations were safe and we were able to secure them without injuring anyone. So obviously no injuries. We didn't have to escalate force. We didn't have to use, obviously, lethal, thank God. We didn't have to use any less lethal options, which would include like pepper spray or batons, things like that. So that's just a breakdown. So I understand when, you know, we're going to see on the news and the media the worst of the things that happen. Like I said, just West Orange Police, 8 times a week we're going to a call. 40% of those calls have the potential to really get violent. You know, we're able to handle most of them. So I'm pretty proud of my department in terms of that. Training that we've done over the years, and again, I can only speak for West Orange. We're nationally accredited, which means that, to put that in perspective, there's only 7 municipal police departments in New Jersey that are nationally accredited. We follow high levels of standards. We get reviewed every year. They come on site and go through all our policies and procedures and reports every 3 years. So it's a pretty stringent process to really find out that we're maintaining our standards. Out of the whole state of New Jersey, like I said, 7 municipal agencies and 15 total. So we're pretty proud of where we're at. Accreditation requires constant training. So my department's been doing training on special needs individuals for the last 20 years that I know of, which means every year we'd have a training block on autism, on identifying schizophrenia, things like that. We didn't start a verbal de-escalation training program until 2016. which I think was one of the first in the state as well. But since then, every year we've been training our officers in verbal de-escalation skills. That's it used to be considered a soft skill, something somebody was born with. Either they got the gift of gab, they can talk to people, or they can't. And the last few years, we realized these are skills you can teach officers if they're willing to learn. The ability to talk to someone, to listen, to actively listen, to make sure that you're part of the solution in a volatile situation rather than escalate it. Because we understand that, our presence in some of these situations can escalate. So we've been annually going over different techniques, sometimes using ourselves as actors, or usually the instructors will present scenarios. So we've been doing that since 2016. About 15% of our department's been through crisis intervention training, which is a 40-hour training block. Again, verbal de-escalation, how to respond, how to identify mental illness, all the developmental disabilities as well. But we're really hoping to get more of our department trained in that, and we're currently working on that as well. I'm also one of our defensive tactics instructors. So when I see, these incidents that end up with an officer having to do a compliance hold or a pressure point technique, I'm the one who reviews it and makes sure that they're using the techniques that we taught them, that it's not a free for all, that they're using a minimal amount of force to accomplish our legal objectives in that scenario. And if we see there's more training needed for an officer or in general, we try to put that into our annual training as well. Programs that we've had in effect for the past few years, one is called Operation Hope, which has been since late 2016. It's also a program that I've been with since its inception, which is the West Orange Police Department provides resources to those with substance abuse issues. If anyone needs help with a substance abuse, it doesn't matter which one, they can come to the West Orange Police Department, and we have volunteers that have been trained who will come in and speak with that person, and we try to get them placement in either a rehab facility or a detox based on their needs. Proud to say we've helped over 50 people in the past few years get placed into some kind of a treatment facility, and we're really proud of that number because we realize people who are having a substance misuse disorder probably don't want to come to a police department. It's probably they want to run away from us, but we just try to be part of the solution. And like I said, there's been some success with it, and we've been able to get 100% placement. Sometimes it takes quite a few hours of calling around, but we've gotten people into the detox or rehab that they needed. So that's been a great program. We started many years ago, Take Me Home program, and it goes back to originally created for people with Alzheimer's. The family member will register them with the police department. They'll give us a picture. We will mark their address in our computer system, as well as put their picture. So if we come across someone who's lost and can't remember where they live, we can look it right up. We have special contacts as well, family member cell phones. And in the same regards, when someone does go missing from a household, we already have their picture. We're ready to roll in terms of letting surrounding towns know and sharing pictures. So that's been a pretty successful program. It's called Take Me Home. And it's not just Alzheimer's. If you have family members suffering from autism, it's exactly what it's made for. So fast forward to what we've been doing now, especially in terms of our mental health response. We started about 6 months ago, and first one in the state of New Jersey that I know about, and it's a co-responder model for mental health situations. And what happened was we partnered with the Mental Health Association of Essex and Morris County, and right now it's just in a pilot program, but many aspects to it. The most important one is that they have a trained clinician who's going to go on mental health calls with us. And it's not 24 hours a day yet. We're hoping to get the grant money to really blow the program out. But for now, we have someone 4 to 5 days a week during the day. If we have a mental health call, like I said, we average 8 a week. We call them. They send a trained clinician on scene with us. So it's not just the officers trying our de-escalation skills, they're professionals who have access to resources. We're a lot better trained in speaking to people and identifying issues than we are. And that's been in full effect since September 1st. Other aspects of this co-responder model is that the MHA will do follow-ups if we come to a household and we realize there's a mental health problem, and even though it's not criminal and we've calmed down the situation, it's ready for us to step out, we'll forward that information to MHA and they will follow up. And it's great because in the long run, law enforcement goes to the same houses over and over again when there's a mental health issue. We deal with the same individuals in the street, whether they're homeless or whether they walk out of their homes to go out on the road, and they're disturbing people by their behavior. So people call the police a lot, and there's only so much the police can do. And this is when we can hand this over to a mental health associate, say, can you please follow up with this individual, make sure they're getting the help they need. The less calls we get, the less chance of a situation going bad, which is our goal as well. So we do the follow-ups, we do the co-responder model. We also have 2 clinicians review our reports and watch all of our body cameras for all the incidents they don't go on. So once or twice a week, they come over, any kind of mental health call gets put on body cameras, because we've had body cameras for about 7 years now. They watch all body cameras from these incidents, and then they come back with their evaluations. The evaluations can be as simple as what went right or what went wrong. They also have an area at the end for training. So based on what they're seeing on all these calls, they're coming up with a training program for our officers. And we would have liked to do it in person, but because of COVID, what they've been doing is monthly videos that we share with our officers, and they watch those videos, which are made specifically based on the needs the evaluators saw. So it's pretty revolutionary, I believe. I can speak for almost all law enforcement when I say, we get nervous going on these calls. It's one of the scariest calls we go on because we don't know. If you could know before you got to any call, whether it was going to be criminal, somebody with a substance abuse, somebody under the influence of narcotics, somebody under mental illness, and it could be numerous different developmental disabilities or mental illnesses, and we don't know, and it's scary for us. And I can't say that we always have the answers for this. So moving forward, we do need more communication. We do need training from people like the doctor who obviously does a great job with Newark PD, and and communication, discussions like this. So I just want to thank you guys again for having me, and I'll be willing to answer any and all questions afterwards.
Thank you so much, Captain McDonald. I'm going to ask my co-chair, Alice Greenberg Sheedy, to open up the chat. I know quite a few people are letting me know that they have a lot of questions that they'd like to ask. Alice?
Okay, so if you direct your question to me, I will ask it anonymously. We have one question in the chat to Captain McDonald. Are 911 operators trained to ask questions to determine whether the individual suffers from a specific mental health issue? What symptoms is he or she exhibiting? What upsets this person, and how to calm this person?
Okay, so yes, 911 dispatchers, especially in New Jersey, are trained by certain standards. And there's a organization based out of Trenton, very government, and they have a list of questions that each dispatcher needs to ask on each call. And it starts with medical calls, and then quickly you determine whether it's going to be medical, whether it's going to be an emotionally disturbed person, etc. So like I said, they do have a list of questions to ask. The biggest issue that we see, and I worked in communications for many years, is that it's very hard to get information from people calling in. I can't tell you how many calls, people call 911, they yell out a location, and they just say, get here fast, and hang up on you. And it happens more often than we like to know. Other times, you start asking questions and you're not getting answers. So it's not that our dispatchers aren't trained. They have a list of questions and they go through these questions appropriate. They just need, and the doctor said it, the communication. Give us as much information as possible. There's some residents in town that when they call us, they know exactly what to say. My son is autistic. This is what triggers him. This is what he does. And it's the greatest news in the world for an officer responding to that call. So if you do have to ever call 911, family member or something you observe, just please give as much information to that dispatcher as possible, because it's going to make the difference 100%.
Another question for you, Captain McDonald. What is the average age of those who you respond to with mental illness?
Oh, that is a good question. I can tell you, I don't have the average age in front of me, but I can tell you just from going through the data when I remember, it's all ages. It's all ages. We have more teenagers than you would expect. And we also have more people in their 50s, 60s, 70s than you would expect too. Not that maybe that's closed-minded to me. I guess any age, but I don't have the exact answer, but it's not specific to one generation or one age. It's really across the board.
Okay. Another question for you, Captain McDonald. The question is, does it make sense to send an officer who's the same race as the individual in an effort to avoid a racial conflict?
I would say in a perfect world, if you could always get the officer to look like and come from the same world as the citizen, could it help? Sure. Unfortunately, it's not a perfect world. We have 100 officers, anywhere from 8 to 10 working on a day. And we, between races and ethnicities and different versions of that ethnicity, there's no way to get an officer for every citizen. The best we can do is just, the officer responding, be well trained, treat the people with respect, whether it's a mental health call or just every call. Treat them with respect, keep an open mind on different cultural differences. I think when you disrespect a cultural difference, that's a deal breaker, making any situation worse. But could it be better? Maybe, but a good officer will always do well. I'll say that much.
Okay. Do you have any comments on drunk drivers?
I don't like them. Sorry. No, it's a horrible thing. And, in West Orange, I know we're at least 2 to 3 times a year, we do a DWI patrol where for a couple of weeks we're out there. We usually try to do it around holidays, 4th of July, New Year's, things like that. But it's always a danger. And when you see the numbers of how many people pass away from drunk driver related incidents, it's enough to turn your stomach. So it's always going to be on our radar. That's for sure.
Okay. And the last one for now, and then we'll go to the mental health players and then open it up again for questions. How much does socioeconomic status affect the awareness and preparedness within the police forces in Newark versus Marlborough versus West Orange and Camden?
Can you repeat the question? Is it in terms of the police department or the citizens?
Within the police department.
Like I said, I don't want to speak for other police departments. I've worked in West Orange 21 years. Obviously, friends and coworkers who are law enforcement and everywhere from NYPD to Newark to the rich towns in New Jersey, and the needs of the citizenry are different. I mean, all ranges and of how you're going to act towards the citizens. There's some towns where the police are there and they get called when their cat's up a tree and the police come running. And there's other cities where, if it's not a serious crime, they're going to put you on a waiting list and they'll get to you in a few days. So I can't speak on the other departments on their reactions. I will say that mental illness and drug misuse is everywhere. That's not a suburb. It's not an inner city. It's not. It's happening in the richer towns. It's happening in the suburbs. It's happening everywhere. That's what we really learned from like the opiate crisis and dealing with mental health issues. It's everywhere.
Okay, so let's end the question answer period now, and we'll move on to the mental health players and then reopen for questions.
Hello. Can you hear me?
Yep.
Okay, great. I just want to make sure that my two players are able to be unmuted at the time, and they would be Alexis Vaxman and John Rogers or Cynthia Rogers. Just want to make sure if you could find them.
Mike, were you able to unmute them?
What is John Rogers?
Maybe it might be
screen name?
Cynthia Rogers, maybe Cynthia and John Rogers.
Hold on. I don't have a Cynthia. I have a John, just a
Okay,
John.
good. Okay, good. That's it.
That's it? All right,
Yep.
hold on. Wait a minute. Bear with me a second.
While you're doing that, I just want to say thank you to the speakers before me. Thank you so much, Doctor. And Richard McDonald, I live in your, I'm a West Orange resident for 28 years.
Wow.
Yeah.
I give you permission to park on the street tonight.
Thanks.
No one will give you a ticket.
Thank you.
Lynette,
Yes.
do you want the audience to participate in the scenario in any way?
No,
Okay.
because I just want to make sure we get through it and then, do Q&A at the end, just to
Very
kind of
good.
make sure we get the time.
Thank you.
You're welcome. So whenever you say go, I can go. Are you find my folks, my
You're ready, Lynette.
Okay, great. Thank you so much. Thank you so much for being here. My name is Lynette Sheard, and I am a director of the New Jersey Mental Health Players, as well as a community education coordinator for the Mental Health Association. And a lot of this you heard as far as with the doctor, with the statistics related to mental health. And what we're going to talk about is, a mental illness and crisis. Must it be life or death? It is that serious. And we're going to, with the players, we're going to actually go through a scenario that you all are going to get an opportunity to kind of get some insight and to see a real life situation. And then we'll have the opportunity to process it. So you are going to see the player scenario, and then I'm going to continue with some more presentations. But again, the doctor covered a lot of this. So I just want to spend more time with the players. So CITNJ, this is the website. This is the training that officers can take related to crisis intervention training. This is a 40-hour training course, and I put the link in the chat. And it is an opportunity for the goal. I'm just going to move this box out the way. The goal is to use CIT officers whenever possible. If you find yourself in a situation where you need to call law enforcement to intervene with a person experiencing a mental health crisis, it's okay to request a CIT officer. So all of you may not be calling from the same town, so check with your local police department and see if they have a CIT officer. So what you're going to see right now is I'm going to introduce you to a family, and that's all I'm going to tell you. Okay, so if you can possibly put these two in the spotlight, I'm going to turn off my camera and we'll begin with Alex on screen. I'm going to stop sharing. Okay. Alex, can you spotlight Alex? Alexis? Okay, all right, thank you. And then when John pops on, so we're gonna play the cue here. All right, here we go.
Hey, Dad. I just left a message with your doctor.
Oh,
I heard you've been off your medication.
no, talk to me. Talk to me now.
Kids, it's okay. It's all right. Grandpa's just a little upset right now, all right? Mommy's got this. I'm gonna talk to him, okay? All right? Dad, please. Can you lower your voice, please? They can't hear you. You're gonna scare them again.
Well, look at these. Look at these, Alex. They're gone. They're gone. I dumped out my medication 2 weeks ago, and I need my car keys. I need the keys again. I've got to get out of here. They're after me, Alex. I need a drink, and I don't have anything. I need to leave. I need to leave now. Listen to me. I'm your dad. Give me the keys. Give me the keys. Give me the keys, Alex.
Dad, please calm down. You know you're not supposed to drink. You know that. You know how you get. Remember last time. Just please. Just come. Why don't you just come here? You know what? Never mind. I'm gonna come to you.
No. Don't come down here. They'll get you. It's not safe here. They're coming after me. Wait, they are here now. I know what I'm doing. Why are you always calling my doctor? Tell her I'm not taking this medication anymore. I just don't want that poison. I'd rather be sick with COVID. I've got my own medication and I've got to get out of here. You can't keep me here, Alex. Where are thy car keys? I need to leave. I'm leaving right now, and I'm not wearing a mask. None of that. I can't breathe in that thing, and I just smell my bad breath. You can't stop me, Alex. And I don't need the keys. I've already called the Uber.
No, Dad, please don't. All right, listen. Please be quiet. The neighbors are hear you. You're gonna scare the kids. Just stop. Please. Do not maybe call the police again. I'm so tired of this. There's a pandemic. I'm gonna have to call the police again. Please remember what happened last time.
Oh, that's my ride. I'll show them. I'll show you. Goodbye, Alex.
No, Dad, oh, no, he really left. Now I have to call 911. Hello? Yes, this is Alex Moore of 121 Morris Avenue. Can you please connect me with a crisis intervention trained officer? I was at the substation last week and I spoke with an Officer Dave about my dad, John. Please, hurry.
Thank you. I'm going to continue with the presentation, but I wanted you all to see that first. Thank you so much for your technical assistance. On behalf of the Mental Health Association, we do understand that Black Lives Matter, and we are celebrating all of that and keeping in mind that, and want to make sure that we inform you that we have a pledge against anti-racism. Again, I wanted to show the CIT slide because it's so important, these crisis intervention teams throughout the state of New Jersey. So, what families want police to know? This is a crisis to them. They're frightened. for themselves, for others, for their ill relatives. Families want police to know that their family member is ill and needs treatment. And so, when the officer was speaking, that it's important, the more information that you know, to be proactive so that you can build a community response for these calls. When families call the police, families are conflicted. Should I call the police? For many different reasons. Get here fast, but they don't want sirens, lights, shame, embarrassment. He's punching holes in the walls, but they fear that their family member will be hurt. He's angry and agitated and out of control, but don't touch him. They want respect from the police. They know their family member better than anyone. Don't ignore them. They have key info that will know what helps to calm them and what doesn't. Just have to keep moving this bar. Worst case, best case scenarios. The worst case scenario, an officer gets injured or killed. The ill family member gets injured or killed. Suicide by cop is a term where individuals with mental illness provoke police into killing them. Some indicators: symptoms of depression, unable or willing to follow a simple direction, as the doctor spoke of. Best case scenarios: police arrive and were able to calmly engage the ill family member, who agreed to be transported to the hospital, where they will feel safe, secure, and have an opportunity to get help, relax, sleep, and feel better. So what mental health needs to do to help families? Mental health needs to educate families to call for help before there is a crisis, to build a team, to understand. Often family members see a problem way before it explodes. When an ill family member misses a medication appointment or stops taking meds or refuses treatment, families need to have a strategic plan of how and where to get help for that person. This is such a family matter. This is not just a community matter. This is a family matter. So there are lots of things that we can do beforehand to have an action plan if this happens, Of course, things happen that may be out of our control, but if we have certain information, for example, how family, I'm sorry, I'm speaking too fast, how family and friends can assist CIT officers. Keep a current list of medications and doctors' names. This is very important, and to do this when the person is well, to work in compliance with the person when they are feeling or at their best, but not to don't wait till the crisis to have these conversations. Keep all guns out of the home. Try to participate in any community CIT-NJ programs. Visit the website, which is in the chat, and find out when there's a program close to you. Educate yourself about family members or friends' mental illness by requesting information from the National Alliance on Mental Illness, NAMI. NAMI has some wonderful programs that are usually 99% free. When not in a crisis, again, find out if CIT-NJ is part of your police department. So before the crisis, call and see what community resources are available in your town. Have CIT-NJ officers stop by your house. How about try something else? Or go to the police station when a CIT officer is there. Get to know your police department. They are people, they have families, they have connections they want to go home to. Introduce your family member or friend to the police. Again, building those relationships. When calling for police assistance, ask for a CIT officer. Ask. When the CIT officer arrives, advise them if the person is armed or has access to weapons. They want to de-escalate the situation. Everyone wants to go home. They don't want to have to intervene in things like this. So the more the information that you can provide the police officer, they will know how to respond accordingly. That's what they're trained to do. Offer the CIT officer a current list of medications and doctors' names when he or she arrives. Meet the CIT New Jersey officer outside if possible and fully explain the crisis and what you would like to happen. It's always good to pre-plan. If there are things that have worked in the past, consider those as potential options before. Or when the person is well, talk about this proactive plan. If this happens, where would you like to go? If this happens, Where don't you want to go? So those things are important. Make the CIT officers aware of anything you know that upsets the person in crisis. For example, depending on their symptoms, maybe the color red, maybe the sound of a siren, maybe, I don't know, maybe it could be a Black person, I don't know. But again, having those conversations beforehand. Be prepared to go to the hospital, but remember, all CIT calls do not necessarily mean a trip to the hospital. Let your family member know the police are there to help. Again, managing the relationship and changing the perception depending on the houses that you go to, because there are people of color and Black and Indigenous people of color who don't have necessarily they have an interesting relationship with police based upon history. Let your family know, remember, when weapons are involved, police concentrate on the possible threat of violence first until it is neutralized. Again, safe. Understand that the CIT officers will probably ask you to wait in an area away from the person in a crisis. That's managing your expectations and what your role is in the big picture to help your loved one. Let the officer do his or her job. Only offer assistance if asked. So there's a lot of pre-planning, but once it's out of your hands, there are things that you have done proactively. There is a system in place. Learn it, understand it, build alliances with your police department. So I always want to share this information. What's really key right now, because this is a split slide, is I want you to, this is a resource, the Mental Health Association in New Jersey. We work very closely with Essex and Morris, and I'm so glad with, and I can probably rattle off some names and you'll know them and they'll love you and all that kind of stuff. So, and West Orange is great. Yay, I love West Orange. There's a call line for free emotional support. It's available 7 days a week, 8 a.m. to 8 p.m. You can be as young as 14. This is one of those proactive measures. Don't wait till a crisis. If you're feeling, if you're a caregiver, if you're a loved one, call and see what it's like to call a call center. You may need that call center. Also, if you have questions or you have comments or you're just looking for resources in your area related to mental health, you can call this number. Multilingual services are available because your mental health is absolutely vital. So that's my presentation. I'm going to stop my sharing here. And yeah, I wanted to be conscious of time. So I have my players here. So Alice, I'm going to turn it back over to you and your team. And I think John is still on Spotlight.
Okay, so I can, okay.
Yeah, you can take them on Spotlight if you like. Yeah.
So does anyone have any questions for the players? You can put those in the chat.
Oh, let me look here, sorry.
Hang on. Yes, they can chat.
Okay.
And thank you, Lynette. What an informative, energetic presentation. We're so grateful. And I think these are resources everyone can benefit from.
Thank you. I wanted to leave room for the Q&A part.
All right. So there aren't any questions coming up for the players right now. So I'll go back to the questions that were asked earlier, and anyone on the panel can answer them. Let's see.
I did want to go back to the question in regards to the socioeconomic status, affect awareness and preparedness. Yes, I mean, I definitely feel as though in regards to areas with different socioeconomic status, if you're looking at like the examples they provide of Newark versus Marlborough, West Orange versus Camden, you know, definitely the awareness that if you're in an area that there's high crime, you know, officers have less time to build community, that old school policing of community interaction building relationships with individuals in their community, because they have to go from call to call to call, where they don't have that time per se. And if every time they come out, it's only in a major crisis situation, that looks different than in certain areas where the example was provided that there's a cat stuck in the tree and they have to help with that. There's time to build those relationships. So really understanding that, in certain socioeconomic, depending on socioeconomic status in the areas that it's in, the interaction between community and police looks different, and that's why most communities, they try to have, events where in non-traditional high-risk situations, people are interacting with officers to build better relationships, so that the first time you're meeting an officer is not when there's a situation. So I just wanted to add that.
So, Mike, I've gotten a text, and then my husband just walked in to tell me the chat is still disabled.
Try it now.
In the meanwhile, there is one other question in the chat that we didn't answer. Which peer recovery agency, this is for Captain McDonald, which peer recovery agency does your department work with to assist with substance abuse recovery placements? And does your department put on regular press releases regarding mental health support interactions?
Okay. First off, I also wanted to say, Lynette, your presentation was perfect from in terms of law enforcement. Every point she made, we agree with 100%. So you made some great points. And I appreciate that, because like I said, the more you help us before we get there, the information, the little things, like if we ask you to wait outside, it's not personal. It's, it's trying to follow our procedures, but excellent job. So thank you. In terms of answering the questions, the peer recovery, in terms of substance use recovery, we had a working relationship with Integrity House down in Newark, and they trained our volunteers initially. However, when we're trying to get placement, if they're full, we just start going through the list, calling anywhere to get people placed. So I can't say we have one specific place after we call Integrity House. We've gotten people anywhere from, out to Pennsylvania to Summit House to anywhere we can. So we don't have one specific. In terms of the press releases, we've been trying. We started social media about 5-6 months ago, and that's actually in my domain, and I'm learning as I do it. I'm not technologically, I just learned how to work Zoom, so I'm getting there, people. But we're trying. We're trying to share the positive stories as much as possible, without being too preachy or without being too, hey, we saw a national travesty, but we're good here. We do everything perfect. So we're trying to communicate our successes as well. So we're working on it.
Okay, so this is to the players. How should the police respond to John, who went off of his medications?
Oh, wow. Okay, I guess to me, well, thank you everybody first for watching our presentation. That was means a lot. I guess this is me. If I think when approaching John, I think being aware, like my character said, that she's, that he's off it. She can warn them that he's off his medication. He's a little erratic. So just approaching with caution, but also making sure that they know that he's not armed as well, so that that way they can approach him calmly and try to talk to him first and not use weapons, because he's not going to hurt anybody, at least to my knowledge.
We intentionally left this open for the sake of time, usually in a performance, and we are available for any of your organizations, that the actors would stay in character and would have to answer your questions, if we had more time. So they would stay in and engage you in that way. And it's left because each individual crisis is different based upon the level of information that you have about your loved one, or information that you should begin gathering now. that you really do need a team of support, because I have relatives who I manage who have mental illness. It's a gauntlet. It changes, especially to throw COVID on top of that, as far as access, just to stay physically safe, these virtual visits, things have changed. So I don't even know how to answer that, because things have changed so much. What used to be a traditional response is now changed because of COVID and some of the restrictions and the access to hospitals, the availability, how you receive the medications. It could be, there's so many different ways that this could play out. But what we wanted to make sure that you were aware of is that Alex was calling the doctor. So she has a relationship with the psychiatrist. So that may be some paperwork that a family member needs to sign off when the person is well, when you can build an alliance. And then we wanted you to know that she also, as a family member, made a previous connection with the police department. She was aware of who to call. She had a name. So there was a connection. They talked about her father. So what he looked like, and whatever that process in each police department is going to be different. But I wanted you to show that there was some interaction and there is some family engagement in putting together a team to keep everyone safe. And also that there were kids in the home who were watching this. So, so there was a lot of things going on here.
What can you do if there is no CIT officer available?
I guess anybody, or?
Yeah, anybody.
Okay, I have an idea, because this happens with, like I said, a family member, is that I still know who to contact at the hospital. I will still have a number to call. I will call her doctor first. I will call crisis and see who's there. I may need to bring my aunt. So it's contacting the police department too, to kind of see what resources that they would recommend locally, but also what's going on with the hospitals, what's going on with the crisis centers, what are those conditions. And I do want to encourage all of you, because again, this plan is very important, and to do it when you're thinking about it, when the person is well and you're in your right mind and all these kind of things, keeping in mind COVID. You can call that 800 number that I gave you. You can call our call center to get information about helping you put together a plan for your family. So, just in case.
Okay. Someone wants to know how often threatening episodes result from folks who do not have a mental illness diagnosis, but folks who are just overwhelmed by something emotional stress, economic stress, marital stress.
I can't speak for exact percentages, of course, and maybe not my area of expertise, but just, on the response side, we're seeing it a lot more. I'll say that just across the board. The COVID and the economic stresses are creating some situations in households. We're responding more than ever to domestic disputes, not violence per se, but more domestic disputes than ever, and more what we determined as mental health crisis. But it just could be that one person who had too much and is cracking from the stress at that moment. So I don't know numbers, but to say that it's happening more than we're used to is an accurate statement.
I would also like to say that our call center, our lines have tripled. People calling in for emotional support. That line is the go-to line from Governor Murphy to say this is the line for emotional support. Is that, again, check in with yourself. Where are you? If you just had too much today, in the midst, just something happened, maybe you lost someone or someone is struggling with COVID, what would you do? Where would you call? Do you know? Find out now, make a call. Start putting together your plan. You may not be diagnosed with a mental illness, but I like to say we're not all in the same boat, but we're in the same storm. And how are we going to navigate some of these waves that are completely unfamiliar to all of us? So agencies are figuring it out. we're all trying to figure it out, but I encourage all of you after this call today, after this webinar, think of a plan for yourself. What are you doing proactively to maintain your emotional wellness now? What are you doing? Are you taking care of yourself?
And I think it's
Absolutely. Oh, sorry. Go ahead.
important to remember that the mentally ill are more often victims of violence than they are perpetrators of violence. And so the idea of mentally ill shouldn't be something that scares one, but they need, right? John needed a helping hand. He thought he would find it in a bottle. He knew he didn't find it in the pills. And what he was doing with Alex was love me when I'm most unlovable. But I think definitely we have to remember that the police are often dealing, and Lynette and I have often worked with state troopers down in Seagirt, and a little empathy goes a long way. And they can't be everything to everyone, but if the helping hand is there, that's so important.
Someone wants to know if crisis intervention officers wear police uniforms and carry weapons.
In West Orange, it's just regular police officers who have experienced some extra training. So there's nothing different. We've talked about maybe getting a patch as an identifier. So we're working on that. And then we've been trying the last year to get everyone trained in CIT. So I was like, all right, well, let's just wait. So in terms of West Orange, surrounding towns that I'm very familiar with, they have some officers that are trained, but it's not a special uniform, and it's not that they're not law enforcement officers. Other parts of the country or larger departments may have a separate unit, or for us, it's just extra training for certain officers.
Okay.
And I think just to add on a bit to just that and the other things that's been said, it's really about planning and creating a plan when you're not in crisis to have a better crisis response yourself and have that crisis response go well. So in some counties, you can directly call the psychiatric screening center when there's a mental health crisis instead of calling law enforcement first. And in some counties, law enforcement, depending on the information you communicate, they will contact the crisis center for the crisis center to reach out to you. You have to educate yourself on what's provided in the town, in the community that you're in, what resources are available. As people are becoming more aware of mental illness, I will say overall, collectively, counties, police departments are doing their best to have resources available. Even in the town that I live in Woodbridge, there is a program where they want to know in advance the individuals within the town that have mental health issues or, for instance, kids that have autism, so that they can meet and interact with them in advance and have information like the captain mentioned, pictures in case individuals go missing, have all this information in advance so that when something happens, everyone is ready to go. Everyone is aware, everyone knows how to respond. So it does take planning on the individual and the family's behalf in advance to make sure that when a crisis occurs, everyone knows how to respond. So even in regards to the uniform, we have to recognize, especially now with the incidents of police brutality and things of that nature, and with social media constantly perpetuating these images of police brutality, everyone is starting to have a more increased fear of police. So that uniform in of itself, regardless of how the officer acts, may be triggering for others, right? And I'm adding on a psychotic episode or mental illness can even further exacerbate that by having the individual interact with officers. So that is why, again, if you're planning, listen, if you do have time, contact the department and say, hey, if I can bring my family member by so they can see an officer when they're not in crisis and get a bit more comfortable with seeing an officer in the uniform, that can help as well. So it's really about planning in advance.
So to your point, Dr. Prempeh, question is, do patients typically get counseling on how to interact with law enforcement?
That is a good point to bring up. It all depends. Every clinician is different in their approach. I think definitely if there has been an incident of an interaction with officers, or if the clinician is aware that the person engages in high risk behaviors, it would be appropriate. It would be appropriate to provide the patient with information around that and even role play that out. But I think, even when you're having this, asking this question, this happens a lot with certain races and ethnicities where parents will have the talk, right, with their kids about how to act when they see an officer to reduce the likelihood of things being escalated, and I think that that's important for everyone in general, right? And so we have to keep in mind that too, when individuals with mental illness are having these interactions, most of the time it's when they're in a psychotic state. So even if they are well prepared, they may not be interacting in their right state of mind per se. But it's still important to have the talk with each and every single person to know how to respond when they're interacting with officers.
Does an individual have any recourse if they feel they're subjected to involuntary treatment by the police?
Of course, legally, yeah. I mean, one of the most important, I don't know if the word right, privileges we have as law enforcement officers is that we can legally take someone's liberty at that moment, whether it's because they committed a crime or we feel they're a danger to themselves or others. So we take that very very strongly. That privilege. If we overstep a bounds, in terms of law enforcement, then yeah, you have as much legal right to file suit. You can make complaints to the police department themselves, internal affairs, county prosecutors, but you can file a civil suit. It's a very impactful privilege that we have to be able to take someone's liberty, even though in our hearts we're doing it for the right reason. It should be, and because someone's a danger to themselves or others. But if it finds out that officer overstepped their bounds, then of course.
With a mental health agitation situation in the home, does a call to police result in an arrest or something put on the family member's record? Or is there some level of de-escalation possible without a blemish to the individual's record? It's a very real fear for family members deciding to make the call versus ending up with a violent situation.
Yeah, and I think that's one of the points that Lynette made. As they're calling, there's shame and there's fear, and you don't want necessarily putting a law enforcement record on someone because there are certain things we do have to do. If we go to a house and someone's been assaulted, we have to act. There's no question on that legally, or else we'd be in trouble ourselves. So yeah, those are fears people have. In terms of law enforcement, like I said, just as an example, out of 200 calls, we had one arrest. And I'm sorry, I forget the exact incident of why we had to arrest that individual. So that's only one that whatever that situation that dictated that person, it might have been possession of a weapon. Now that I remember, unfortunately that is going to create some kind of a criminal record. I've seen charges of assault and things like that expunged later when they show that it was a mental health crisis. And but that's through the courts. That's not through us. So like I said, we try to verbally de-escalate every situation. The last thing we want to do is arrest someone in a mental health crisis. But in terms of if we transport them to a facility, that doesn't go on a legal record. I'll put it that way. That has nothing to do with the police department. That's a whole other area that I'm not familiar with. But
anyone else want to comment on that?
I just really quickly and don't take this the wrong way, because you guys are great here in West Orange. I live here. We're still safe, very safe, is that a lot of people do not have that relationship with their police department. A lot of communities do not. And to call the police is the absolute last resort. The last resort. So again, it goes back to that planning and seeing what other resources are available before you get to that point, even if it's outside of the system. Having family members share certain responsibilities as far as keeping the person or helping that person maintain their level of wellness. But in a lot of places, the police is the last resort. But even if they are the last resort, if there is a way to proactively let them know of possibly how they can support, because it's one thing, they're going to keep themselves safe, and they're going to make sure that everyone is safe. They're going to reduce the harm. That is the goal, and that is their responsibility. Whatever we can do beforehand so they know that their lives are not in danger, that this person doesn't have this or that, and this is what's normal to that person, because there's no such thing as normal. When we don't know each other, we respond to perception, and perception gets Black people killed. So we have to really, really be careful in even having that conversation. If I call the police, I'm going to try to make sure that they don't have the siren on, that they're here to help you. Having these conversations, this person is aware, they're not gonna harm you, just kind of become, I'm gonna be with you, but understand the process, because every town is different. And while 90% of police officers are good police officers, but there are some not so good ones as well too. And if they're also under stress, because a lot of police officers don't manage their mental health like they should, because if you do that, is it going to be a stigma to your partner so there are lots of factors to consider. But it always goes back to your own individual plan, and get these numbers, get the phone numbers, call them first before you have your family member. I mean, just do it like it was you.
Okay. How are mental health professionals trained in terms of understanding the challenges that police officers face walking into situations where a situation has already escalated? Do they have the experience of being in the trenches like you do, Captain McDonald?
So
I'm not sure if I can answer that. I'll give that to the doctor.
the question is in regards to how the mental health professionals.
Yes.
Okay. So I would say that as we do with certain disorders, like I did today, being aware of what symptoms and then in that disorder can create to more instances of involvement with law enforcement in general, right? So sometimes it's not just the aggressive behaviors, but when we're talking about substance use and substance abuse, right? Addiction and things of that nature, well, what the person does to be able to get the substances, right? Engaging in criminal behavior and things of that nature. So you do have an awareness of how certain symptomology with disorders can increase the likelihood of police involvement. And then in regards to, I think the second half is, do they have the experience? Well, and then I think the flip side of that too is understanding the stress, like Lynette mentioned, of police officers, right? In regards to supporting them, like I said earlier, in certain departments, or just the fact that officers are exposed to things that human beings are not supposed to be exposed to, sometimes on a daily basis. And hearing stories of things that happen to individuals that we're not wired to hear often at all, right? And I say that even with myself as a psychologist that works in the field of trauma, that in of itself can impact the individual, the mental health professional, and even officer as well. And that's why it's important for us to also take care of ourselves. When I say us, I'm talking about the mental health professional and officers, to take care of ourselves because of the the things that we're being exposed to, and what we would call vicarious trauma that the officer and mental health professionals oftentimes experience working in this field. Because there can be a lot of impact, symptoms that we can endure from vicarious trauma that can impact our work performance, right? So, being exposed to, let's say, a child death and having flashbacks about that, right? And experiencing our own post-traumatic symptoms as a result of that can impact how we show up on the next call or in sessions with our patient and things of that nature. So the flip side of it is also for ourselves, the mental health professional and officers, taking care of ourselves. I know it's a bit more difficult in regards to officers because officers want to ensure that they continue to do their job. That's their livelihood. And it's unfortunate when some departments speaking up about vicarious trauma, such as, that last call that I went on of domestic violence and having to see 2 family members beaten up brutally was very difficult for me. And expressing that can mean, oh, wait, well, then you have to sit out for a while. And what does that mean for the officer, right? So it's unfortunate when police departments are not providing that support and acknowledging the pressures and hardships that officers have to endure in their day-to-day job so that they can be more effective to others. I think we can't, oftentimes when incidents happen, we can't just blame the direct officer. We have to take a bigger look at the system and say, well, what supports are in place for officers for their own mental health and well-being so they can perform effectively.
Okay.
So there have been many, many questions in the chat about news today in Rochester, New York, and police not being held accountable. And the question is, how can more police departments and law enforcement become committed to verbal de-escalation and use mental health professionals while responding to mental health crises?
I would just like to say, just as much as earlier I was saying on the family and the individual with mental illness piece is being prepared, planning in advance. The flip side to police departments is education, 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 increasing knowledge and awareness about mental health, racial and ethnic differences, cultural differences, right? The captain expressed that earlier. Being aware of cultural differences and trying your best not to disrespect someone's culture, because that can completely go left in the situation. So it's the same with mental health and understanding, educating yourself that if a family member says they do share the information that someone has schizophrenia, knowing what hallucinations look like, knowing that you, at that point, you are not about to convince someone who's actively psychotic that that person they see over there that you, the person, do not see is not there. That's not what you do. You're not here to convince them. You have to go along to just help them to calm down. So education on the flip side for the officers and police departments is important to have them respond better to decrease these incidents, right? Education is important.
And I just really quickly, as far as that education piece, and John mentioned as far as empathy, is that when we teach mental health first aid to police officers, one of the things that we say a lot is that it really is about that connection to the person and not the correction of the behavior. Even though that is the focus and that is the training in the academies to de-escalate, to to just remove, to really, I can't find the word, but it is to just do no harm, to just, I can't find the word, but my point is that trying to make a connection with the person or the community and not correction of a behavior, because the behavior may be as a result of the mental illness. And that's where the information could come in handy as far as learning signs and symptoms, possibly knowing what questions to ask, building a lot, opening up the doors of conversation with the family member who's calling you, or, whoever the community person is, or just understanding the community resources within your area, so that you can educate and maybe have trainings together to share this information, because there's always this latest and greatest stuff that's out here. And because of COVID, a lot of things are virtual. So, getting that hands-on training, like John and I spoke of, we go down and we train the police officers with real life mental health simulations. But now we can't do that. So we have to figure out a way. So things are changing, but making that connection, even as a family member, talking to your loved one, it's not about you fixing them. It's not about you correcting their behavior. It's making a connection with them so that they are able to talk to you. As the doctor mentioned, someone who's delusional or hearing voices, and they tell you that they see Martians, you're not going to say, no, you don't. You roll with it. You say, oh, really? What are they telling you? What are they saying to you? Do they say they're going to hurt you? Are they going to hurt me? Ask questions, because it's about a connection. It's not about a correction of a behavior.
So I know there are other questions in the chat, which leads us
There are 26 more questions. I have not gone through all of them.
Yes. So our program, we have to bring our program to a close, but that amount of questions allows us and lets us know how interested people are and how passionate they are about the mental health and the connection or the interaction with the police. Certainly, there are provocative videos online. There's headlines, sadly, every day in the news about this. And we're so grateful for the information from Captain McDonald, Dr. Prempeh, Lynette, you're amazing. By the way, it's a free service, the mental health. These are all volunteers. They've been around for, I think decades. I first saw their in person, and I'm so glad that my co-chair insisted that we include them as our program was shaping up. We want to be sure to thank Sisterhood and Men's Club for partnering with us on this program, again, for the generosity of the princes. We thank our panelists and of course, all of our friends and dear family that participated tonight. We thank Mike Schatzberg for filming, and this was recorded and it will be on YouTube. There's been some good information that was shared. Alice, would you put your email in the chat? And anybody that shares our email will be happy to send that information to you. Lynette has some really phone numbers.
So that is one question. Can Lynette repeat the phone number for emotional support that she displayed on her slide? It was blocked.
Okay, maybe you can put that in the chat, Lynette.
Lynette, you're on mute.
It is in the chat.
Oh.
I just put it in the chat.
Okay, so it's 866-202 HELP, HELP.
And I think the strong message here is planning and connections and relationships. We're so grateful for your participation, and we hope that you found it informative and that you will partner with both our Social Justice Committee and our family, my family, to perpetuate my nephew Alex's and Alvin's legacy by helping to destigmatize mental health issues and to work towards true social justice. As we know, Dr. Martin Luther King said, injustice anywhere is a threat to justice everywhere. We encourage you to attend our future events, which will include microaggressions and outdoor movie night, where we'll be filming some Black Lives Matter film and having a discussion on issues of social justice and race. Thank you again to everyone, and have a good night.
Thank you for having me.